Welcome, everyone, to this month's National Equine Health Conference call. Thank you for joining us today. As a reminder, our next call is May 8th, and I thank those of you that have submitted speaker and topic suggestions as we are trying to accommodate all of those speaker requests and topic requests moving forward. So without further ado, I will just get on with today's agenda. And our first speaker is going to be Dr. Kara Wright, and she is going to present an investigation of the role of exercise in detection of selected respiratory pathogens from nose wipes collected from healthy horses. And I nicknamed this the nose rag study, my biggest pet peeve in the show horse world. So I'll turn it over to you, Kara. Thank you for your time.
Awesome. Okay. Thanks, everybody. Give me 2 seconds to get my screen sharing. Hopefully. Is that showing up for everybody?
Yep, it's good.
Okay.
Thank you.
Awesome. Well, you guys are lucky because I'm here to get to talk to you about this, and then Dr. Pasterla, who invented this study and helped me get through it and get it done, and his lab did the testing, is on this call as well. So that's kind of like the high value participant. So anyway, thank you guys for being here. So we're going to talk about this paper that Katie just told you is about using exercise and nose wipes to detect respiratory pathogens in healthy horses. So the idea behind this paper was pretty simple, right? First of all, we know that subclinical shedders of disease can introduce different diseases into other populations. We worry about this a lot, obviously, at equestrian events and horse shows. We also worry about it at boarding stables and rescues and places like that. So we spend a lot of time looking for sick horses, right? We're temping horses at horse shows. Anybody that looks sick gets isolated, but we don't spend a lot of time looking for subclinical shedders. Another thing is that, and any of you that have worked out in the field, you know that performing nasal swabs on horses can be less than fun, right? It can be annoying. The horses hate it. Your shoulder can get tired. Anything we can do to kind of make something easier for practitioners in the field would be a bonus, in my opinion, to try and figure out what's going on with horses. There have been a couple of previous papers that have looked at using less invasive sampling techniques, such as a nasal wipe or swabbing at the rostral muzzle, that had pretty good agreement with certain pathogens. So this was something looking a little bit further. So the aim of this study was twofold. So the first part, determining if exercise increases the shedding of these respiratory viruses and bacteria in these healthy horses. And then number two, to determine if this nose wipe is actually effective at finding these respiratory pathogens. So sample collection we did last spring in April and May. We had 3 different locations of racetracks. They were in California, Oklahoma, and Maryland. We also had 3 horse show barns they were hunters, jumpers, and dressage barns in the Bay Area of California. All of these horses had both of their nostrils wiped before exercise and then again after. And this was just their routine exercise. So whatever their discipline, normal exercise was. Samples were then placed in a tube and then overnighted, refrigerated to UC Davis to the PCR lab. The lab ran assays on all the samples, and we looked at 2 different groups of bacteria and viruses. We looked at commensal organisms, so equine herpes virus 2, 5, and then strep zoo epidemicus. And then we looked at common pathogens, EHV1, EHV4, and strep equi. We looked at those commensals because we knew that those were a good place to start with being able to find organisms. If we weren't going to see any of those on any of the wipes, then we knew that the wipes were not really going to be an effective way of looking for things. And I do want to point out, if you can see this very cute pony, he's about 10 hands, he's 20 years old, and he was awful. He was the worst patient sample collection that I had to do in this whole study. I thought you might like to see him. So getting into our results, we had a total of 133 horses. They ranged from 2 years old to 20 years old. We ended up with 43 show horses, which ranged from 5 to 20, and then the 90 race horses were younger. They were from 2 to 9 years old. The race horses skewed thoroughbred. There were 63 thoroughbreds and 28 quarter horses, and then the show horses were 25 warm bloods, 15 ponies, and 2 Lusitanos. So now we get into the fun stuff. So we looked at two different things. We looked at both the frequency or how common detecting these pathogens were, as well as the absolute number, the absolute quantitation of these respiratory microbes. So this figure here shows the absolute quantitation and the total number of those target genes of those microbes here on the y-axis. On the x-axis, we have the different pathogens that we looked at. We've got a pre-exercise and a post-exercise column for each pathogen coming here along the x-axis. And then on the top, for each pathogen, we have the p-values. So comparing the pre and post-exercise, whether that was significant. And then, of course, each dot on this scatter plot for each pathogen is one of the samples. The red line represents the median value of that quantitation for each pathogen. So what we can see here is when we look at that red line median, it is statistically significant lower for EHV2, EHV5, and strep zo. For EHV1, even though it looks nice, like, oh, look, there's a big difference, it actually didn't end up being statistically significant. And then the number of horses that sampled positive for EHV4 and strep equi, excuse me, you can see here we don't have a p-value. That's because we didn't have enough samples to actually run any statistics. We didn't have any pre-exercise show up. We only had 2 horses test positive for both of those in their post-exercise sample. So too low to perform meaningful statistics on that. When we start looking at the frequency of detection of these pathogens, so this is the total number of positive horses, not the amount of pathogen that we were seeing. This is where we saw a few interesting differences. So the first thing that we noticed is that we did see a significant increase. So you can see here it's with the asterisks, and then I'm highlighting it here in these teal circles. It increased significantly in the post-exercise wipes for both EHV1, EHV2, EHV5, and strep zo. So you can see those circled. Post-exercise detection of that EHV4 and the strep equi, again, we can't perform any meaningful statistics because we didn't have any pre-exercise positives, only those 2 post-exercise negatives. Generally, when we talk about those commensals versus those other pathogens, the frequency of detection was higher in those commensal organisms compared to the EHV1, EHV4, and strep equi. But again, we kind of thought that is what we might see, right? We know that these horses are carrying these pathogens and shedding them kind of all of the time. And those are circled in teal, those commensal organisms. We didn't know how much EHV1 for strep equi we would see, since those obviously are something that we see more sporadically in populations. Another thing that was interesting, circled here in yellow, is that we can see that the younger group of horses, so remember these race horses in this left-hand column, they had a median age of 3 years. They were younger than those show horses who tended to skew older. Their median was 13. They had more EHV1 showing up than the show horses, same with EHV4. But again, with that EHV4, with only 2 positives, we can't actually run any meaningful statistics. And then the last thing I'll point out on this frequency of detection is that we just saw a higher frequency of detection in the racehorses across the board for both the EHV1 as well as those commensal organisms. So then that'll take us into our discussion about some of this information. In case you were wondering, these horses were all victims of our sampling, but we don't know which one of those has any of the things, right? It was totally anonymous. But regarding frequency of detection, in the current study, we did see, right, that the EHV1, 2, 5, and strep zo was higher in those racehorses compared to the show horses. Why is that? It could be work level, it could be the increased respiratory and rate and effort potentially compared to the racehorses with those show horses. Also could be the age differences between those 2 groups. Most prior research shows that we are going to see more of those pathogens in younger horses, so that fits prior research. Talking about the quantitation, so the actual numbers, the frequency of finding these things increased post-exercise, but the absolute quantitation decreased. So this could be due potentially to some of that increased mucus that gets expelled during exercise, potentially diluting the pathogens. If you ride bikes or run or ski or any of that, I know that you know very clearly what I'm talking about, increased nasal secretions during exercise. But we did not actually quantify the amount or the cellularity of the samples to know that for sure. So when we're talking about mucus, looking at this study, it does seem potentially that this mucus trapping these respiratory viruses and bacteria that gets cleared during exercise could potentially represent a diagnostic target, since we did see the EHV1, 2, 5, and strep zo higher frequency in those post-exercise wipes. We know that mucus clearance increases with exercise, and we know that in humans, at least, the cellularity of the mucus has also been shown to increase with exercise. So this actually does fit with our present results. Talking about those commensal organisms again, I know we had them in here basically so that we would know if those nasal wipes picked up anything at all. And we know that now that is true. We see some stuff when you're picking up pre and post exercise with the wipes. So we can't necessarily say yes for sure, because obviously the gold standard, the reference standard, is going to be nasal swabs, or in the case of strangles, a guttural pouch lavage. But definitely gives us something to look forward to do maybe another study to compare them directly. And then, of course, the reason that Dr. Flynn has me here talking about this paper is that it means that people should really stop sharing those nose wipes at the horse shows, right? When you're outside the hunter ring at thermal and the guy is wiping the dirt off everyone's nose with the same towel, we now know for sure there's probably something else on there and they should quit doing that. Regarding EHV1, we talked about showing that increase in the frequency of shedding EHV1 post-exercise, which maybe could be useful in potential exposure situations to find those subclinical shedders. It was pretty interesting that the thoroughbred racehorses are the ones that shed the EHV1, not the quarter horses and not the show horses. We don't know exactly why that is, differences in environment or the breed potentially. There have been previous studies that have shown a higher frequency of latent EHV1 infection in thoroughbreds compared to other breeds. So maybe that is what we are seeing here, is higher rates of subclinical shedders in those thoroughbreds. It is also interesting to note, you will remember in the title of the study that these were healthy horses. So none of these horses were sick, none of them had nasal discharge. So we are definitely, this is showing us that these things are definitely getting shed by healthy horses out there in the environment. Oh, I think I'm frozen. Last thing I want to talk about really quickly is those gamma herpes viruses, so the EHV2 and EHV5. We generally understand that they're ubiquitous, they are everywhere in equine populations. If you are lucky enough to write a paper about them, you will fall into a very deep rabbit hole about everybody arguing about the clinical relevance of them, which is not agreed upon, it's uncertain. But in this study, we can say we saw more EHV2 and EHV5 than we did EHV1 and 4, which does fit prior reporting. And it also fits with our age groups of these horses, that we are more likely to see them in younger horses. I already mentioned, I think, that the EHV4 and strep equi had too low of numbers to draw any conclusions on using nasal wipes or exercise to find either of those two pathogens. Strep equi, pretty interesting, because we didn't really know what to expect with that. We know, right, as a profession, that strep equi likes to hide in the guttural pouches, but we didn't really know what would happen with secretions or airflow or any of the changes during exercise to that area. So it was interesting that we saw the only 2 positive strep equis on the post-exercise wipes. Guttural pouch lavage, as everyone knows, also maybe not the most fun thing that you have to do as a practitioner. So future studies could potentially include comparing guttural pouch lavage to some sort of post-exercise wipe or swab or something to see if we can decrease that burden on the practitioner and make finding these horses a little bit easier. Lastly, I'm just going to mention a couple limitations. I know I've mentioned a couple already, but again, this was kind of a self-selected population that we just picked to see if we could pick stuff up on nose wipes and if exercise made a difference. Again, we did not do swabs and we did not compare directly to swabs, which are the reference standard. The other thing that we did not do was standardize the exercise or the timing of the post-exercise wipe. I'm not sure if that would have mattered either way for the purposes of this, but we didn't. And again, basically some interesting info came out of this. I had fun writing it. I had fun wiping horse noses, and I hope you guys are having fun listening to me, but that is all I've got for you. So thank you for your time.
Sarah, there's 2 questions that I have.
Sure.
One, I think you alluded to when you were just talking about the limitations, but how soon after exercising was the samples collected?
Yeah, so our instructions were to the barns and the grooms and whoever was doing this was wipe the horse's nose on the way out to exercise and then wipe it on the way back in. So, I guess theoretically, whatever that means to those people, right? How fast does a horse get back to where the person is standing after its exercise?
The other question was, what time of year were these samples collected?
They were collected last spring over 2 months, April and May in 2024.
And the last question I have is, what health parameters besides no observed clinical signs were utilized prior to sampling?
That was it. Just outwardly healthy horses was the requirement.
Okay. Well, my message to people is please stop sharing these nose rags. Now I can say there's actually science to show the risk. I don't see any other questions, Kara, so thank you.
Okay, awesome.
Remiss, I apologize, I didn't say. Dr. Kara Wright is with Merck Animal Health. And so she, as well as others on this paper, we commend them for doing these really important studies. So thank you, Kara, for your time.
No worries. Thank you all.
So at this time, we're going to transition to Dr. Nicola Pasterla out of the UC Davis Veterinary School with investigation of an EHM outbreak in a population of aged working equids.
If I can get it started, huh? That's always a good question. Good morning, ladies and gentlemen. Thank you, Katie, for inviting me and allowing me to present this outbreak. I hope you can see it.
Yep, we're good to go. Thank you.
It's always a pleasure to be here and then share some information. I was actually, how would I say, surprised that somebody wanted to hear about this this outbreak. But as always, I like to use outbreak because I feel like every single outbreak is investigated and we can only determine certain part of the outbreak, gives us a little piece of information, which most of the time is more confusing than anything else. I'm going to talk to you a little bit about an outbreak that we experienced in 2024 in a population of older horses. It's going away from the EHM outbreak you have seen in recent years associated with sporting event. This is a study that we did in collaboration with a private practitioner from Gardnerville. That person was key in collecting the clinical information as well as the biological sample. But before I jump into describing this outbreak, there's a recent study from the Michigan State University Group and the Glock Equine Research Center that came out and looked at age as a predisposing factor for the development of EHM. And we know that we have known that for quite some years, that generally when outbreak happen, we see a greater incidence of EHM cases in older horses. In that study, and maybe for you, Katie, it would be worthwhile having this group come and present this study because the results are very important to the industry, the way we handle this outbreak, and who should we, pay more attention to in regard to protecting these horses. So this is a study where they used two groups of horses, a group of 2-year-old horses, a group of older horses, and infected these horses intranasally with a neuropathogenic EHP1 strain. And they looked at different outcomes. They looked at clinical outcome, they looked at shedding, they looked at viremia. And I tried to do justice to this paper and this table here. I highlighted some of the key findings for the young groups and the older groups, and the lower three tables give you an information on body temperature, nasal shedding, and viremia. So to make a long story short, what they saw in young horses 2 years of age, and there were 9 of them, they saw that fever increased rapidly, high temperature, and that fever persisted for 4 to 5 days. And at the same time as these horses displayed fever, they also displayed consistent respiratory signs. We're looking at nasal discharge, we're looking at coughing, mandibular lymphadenopathy. On the other side, if you look at older horses, and I'll try to get my little pointer here. When I'm trying to do that, I mess everything up. There we go. Okay, this is looking at temperature. For the older horses, what they saw, I'm showing here with a point, if you can see it, it was a delay in increase in rectal temperature at a time where respiratory signs weren't there. These older horses display no to mild respiratory sign, but interesting, this peak of elevated rectal temperature, which was lower than the younger horses, coincided with the peak viremia and also coincided with the development of neurological deficit. They had 1 out of 9 young horses with self-limiting ataxia, 1 out of 9 that developed neurological deficit, while all the older horses developed neurological deficit, with 6 out of these 9 horses eventually being euthanized due to recumbency. If you look at nasal shedding, I'll be here, the graph in the middle, nasal shedding in young horses peaked quickly after onset of inoculation and lasted for a long period of time. If we compare that to the older horses had a lower shedding amount of virus shed for a shorter period of time. And if we look at the viremia, it's just the opposite. Horses that were old had a high level of viremia, showing here with the pointer, versus the young horses. In general, if we look at the cumulative effect of virus that was shed for each of these groups, we know that the older horses shed 32, the older horses had 32 times more virus in blood compared to young horses, which then brings the endpoint, which is we know that duration and peak viremia that predisposes horses to develop EHF. Now, this wasn't the purpose of my presentation. Purpose of my presentation is actually to give you information on the outbreak that was experienced a year ago. But still, it sets the stage to what potentially can happen in older horses. So again, as I said earlier on, this is an outbreak that happened in the summer of 2024. This happened in the Sierra Nevada mountains at a horseback riding operation. They had, like most of these operations, a layout in the husbandry that wasn't perfect. They had all these animals, total of 33 equids, 32 horses, 1 mule, 28 were resident, 5 were outside horses, and they were kept in 2 large pens with shared feeding and water troughs. Can you imagine every single horse had contact to the other horses? When we're looking at the outside horses, these were 5 horses that were brought in 15 days prior to the onset of the outbreak, and they had been isolated for a total of 9 days before they were mingled with the rest of the population. There was, in the vaccination history, all these animals were vaccinated against core antigen, but no vaccine against equine influenza virus, as well as the 2 alpha herpes viruses. There were 8 mares, 25 geldings. Most of them were draft horses and quarter horse mixes, with an age ranging from 7 to 30 years. The median age was 20 years. So an older population of horses overall. So this started the first week of June. The veterinarian was called to euthanize a recumbent old horse. So in honesty, I'm a veterinarian, so
Hi, Kaylee.
that's not unusual.
Good. How are
And euthanize the horse. Unfortunately, this horse was not necropsy. As the veterinarian was there, the veterinarian was presented with a second horse, an older horse that was presented with a veterinarian with an elevated rectal temperature. So the veterinarians put 2 and 2 together, think like, there's a recumbent horse, plus a febrile horse, and thought, well, we better check out EHV1. She collected blood and nasal secretion, submitted to a diagnostic lab, and 24 hours later, the result came back as EHV1 PCR positive, both blood and nasal secretion. We're dealing in this instance with a non-neuropathic genotype on N752. So this is where it all started. This is when I get excited and get to call the vet and kindly ask him to collect samples. So the veterinarian was kind enough to play the game with us. She recorded all clinical data and medical treatment over a period of 35 days. That's the time it took from the onset of outbreak, quarantine to release of quarantine. Blood and nasal secretion were collected for the molecular detection of EHV1 with quantitative result, but we also wanted to look at antibody detection at time point 0 which was 2 days after the outbreak was determined, as well as day 21. And what we did with these samples, we determined antibodies using Cornell's EH1 risk evaluation assay that looks at total IgG and IgG47 subtype. We look at clinical signs. Within the first week, we had a total of 18 horses that developed clinical signs. And I grouped these horses in 2 categories. There were 4 horses that developed fever and respiratory signs. This would be the EHV1 group, and that's a kind of definition that's been used in the past. And then there were 14 horses with neurological deficit. This would be the EHM group. These horses display ataxia, proprioceptive deficit, weakness, recumbency. There were 2 horses with peracute onset of vestibular signs, as well as urinary incontinence. And the last group was the group of healthy horses. These were horses that within the 35 days never developed any abnormal clinical deficit. A total of 6 out of the 14 horses had to be euthanized, or mainly because of the recumbency, as well as the acute onset of vestibular signs. That's a fatality rate of 43%. The treatment was left at the discretion of the farm manager or the ranch manager, as well as the attending veterinarians. There were some financial constraint. Can you imagine so many horses? This type of treatment is not necessarily cheap. The treatment of EHM horses consistent for the majority of the horses in the use of antiherpetic drug, anti-inflammatory, steroidal and non-steroidal, as well as anticoagulant. The outcome of the treated horses was that 6 horses were euthanized, 5 horses showed a full recovery, and 3 horses 6 months after the outbreak still had residual deficit. The EHV1 group horses, 4 horses with fever and respiratory signs, is generally the horses that are treated in these outbreaks. These are the horses that haven't developed EHM. So these are the horses that potentially we can prevent the development of EHM. Had a very similar treatment regimen. They use antiherpetic drug, anti-inflammatory, steroidal and non-steroidal, as well as anticoagulants. And none of these 4 horses ended developing or progressing into EHM. We ended testing nasal secretion and blood at different time points. Day 2, which is 48 hours after that June 3rd, where the veterinarian euthanized that horse. Then we did approximately weekly basis, day 7, 15, and 23. All the EHM horses had EH1 detected in nasal secretion and or blood. We had 3 of the 4 horses with fever and respiratory signs that had EH1 detected in blood and or nasal secretion, and only 2 healthy horses had EH1 detected in nasal secretion and or blood. If we look at this lower graph on the left, this represents the amount of target gene per million cells. So look at virus per swab. There's approximately 1 million eukaryotic cell per swab. We go from the onset of outbreak, where 13 out of 31 horses tested positive in nasal secretion. Why 31? Because the first one was euthanized without sample collection. And then there was another horse with an acute onset of vestibular signs. They couldn't get any samples on this horse. That's why we have 2 horses missing out of the 33. So 13 horses, positive nasal secretion at onset, goes down to 3 after a week, down to 1 after 2 weeks, and 0 on day 31. So it's a very steady decline, as we would expect. Very similar for blood. We had a high number of horses viremic. In this instance, 15 horses were viremic at onset of the outbreak, went down to 5 at day 7, 1 at day 15, and 0 at day 31. Again, a steady decline in amount of virus and number of positive EH1 cases in both nasal secretion as well as blood. Then we looked at antibodies. Interestingly, all the 31 horses had detectable antibodies at the beginning of this outbreak. When we look at the different group, and I'll show here these two graphs. So both graphs are very similar. They represent the level of antibodies expressed in mean fluorescence intensity. The left graphs represent the total immunoglobulin anti-EHV1 IgG. The graph on the right represents a subset IgG4/7. What we found is that at onset of the outbreak, we did not see any significant difference amongst the three group, which is EHM, I'm showing it here with a pointer, EHV1, and healthy for both total IgG and IgG4/7. When we look and compare acute and convalescence, there were significant differences for both type of antibodies in the EHM group. So we're going from acute to convalescent for the EHM, for the EHV1, acute and convalescent. And as you can see, for the healthy horses, there was no significant difference, a similar level of antibodies. Now, what we have to take into account, it's one of the caveats of serology when you collect sample at onset of the EHM outbreak, is that infection, we can assume that infection has happened somewhere 6 to 10 days before. So it would have been very interesting to have the antibody levels prior this outbreak. Unfortunately, that was not possible. Why that is because these level of outbreak allow us to determine the biomarker of protection. It allows us to determine if horses are protection at what level against EHV1, not EHN, but against EHV1. Now, I wanted to finish with, what have we learned, and how can we apply this type of information? So interestingly, this outbreak was one of these outbreaks that, although detrimental in the outcome, it went really fast, and that goes together with the commingling of these horses. So commingling of horses leads to greater transmission, and this is why we had all these horses developing clinical signs within 1 week. So husbandry practice that is not ideal, but unfortunately that's the only husbandry practice that they could actually apply at that place. We asked ourselves about the source of the outbreak, and it's always I think it's human nature trying to find a potential cause and a potential source, and it is very appealing to think about these 5 non-resident horses that were brought to the place, were only separated for 9 days, and then were commingled with the rest of the population. The interesting part is that these 5 horses were amongst the youngest horses. They never developed clinical disease throughout the 35 days. They never had EHV1 detected in blood or in nasal secretion, and they never seroconverted. It's a very similar scenario that we experienced in an outbreak that we documented in 2011 at a packing station, where 2 outside horses were brought in for the weekend as riding horses, and then 10 days later, they had an outbreak that involved 150 animals. Another interesting part is the exposure rate amongst these horse populations was very high. We always look at EHM as the trigger for the outbreak. And you think about it, EHM really happens at the tail end of an infection. By the time you see a neurologically affected horse with EHM, you need to assume that 5 to 10 days prior to this horse displaying neurological deficit, there has been EHV1 spreading silently or potentially with subfebrile rectal temperature, even febrile horses. So my point is there is a time lag which predisposes the outbreak. That's generally what we see with larger outbreak at a question event as well. Age in this outbreak definitely played a role. We had a median age population of 20 years, and we know from the study that I presented initially that age predisposes horses. Age leads to a different immune response, which predisposes viremia, which per se is probably one of the key elements in potentially causing EHM. We had 14 out of 33 horses that developed EHM. We had 6 out of these 14 horses that eventually had to be euthanized. So relatively high attack rates and a high fatality rate if you compare to other outbreak. There's a question about the vaccine. Did the vaccine or the lack of vaccine predispose this outbreak? We don't know, because the vaccine against EHV1 are highly controversial in either predisposing EHM, there's different studies out there, and on the flip side, vaccine has been shown to prevent the detrimental outcome, which is euthanasia of EHM horses. So we're still kind of in the trying to figure out, are vaccine beneficial or vaccine a potential risk factor? In this instance, I would say that because the horses were unvaccinated, these horses were at high susceptibility to infection. It also shows, as we have experience, and I see EHM cases in our hospital, and the horses that present with recumbency or acute onset or vestibular signs are horses that are less likely to survive the infection compared to horses that display mild to moderate neurological deficit and never become recumbent. Now, the duration and peak of viremia has been shown as one of the key elements, key predisposing factor for the development of EHM in horses. And that's been shown in experimental studies. And if we compare here the viral load between EHM horses compared to EHV1 horses, EHM horses had a 10-fold higher amount of virus in blood compared to horses that only display fever and nasal secretion. The treatment seems to be beneficial. Definitely the treatment had a positive effect on EHV1 infected horses, so horses with fever and respiratory signs, since none of these 4 horses progressed into developing EHM. However, the question is always, well, how essential is treatment in these horses? And I see some benefit. We know that some of these drugs, specifically the antiviral drug, once the horse displays neurological deficit, will not change the outcome. The rest of the drug, anti-inflammatory, anti-thrombotic drug, will have the advantage of reducing future progression of this condition. One of the advantages in a sea of using anti-herpetic drug is truly in reducing the amount of virus that is shed in the environment. So it has benefits in reducing environmental contamination potential, reducing the transmission risk. We saw an increase in EHV antibodies only amongst horses with clinical disease. And if we look at the initial EHV1 antibody levels, we were unable to associate this level with the disease form, the outcome. So we couldn't say, okay, based on this level, this horse is gonna end developing EHM, or based on this level, this horse is gonna survive and not. But again, the caveat is here that we don't have the pre-outbreak antibody levels. These are the levels that are essential in order to determine what is the risk of this horse to potentially, what is the susceptibility of this horse to potentially develop an EHV1 infection. We know from recent work from the group at Cornell, Dr. Wagner's group, that mucosal antibodies are probably the best surrogate to determine protection against EHV1 infection. Now, is it also true for EHM? We really don't know. These studies still need to be done. So I want to look and want to finish here with a take-home message. We know that EHV1 is an occupational hazard of horses. It's there, it circulates silently. Every time you put more than one horse together with another horse, there's a risk of silent or clinical spread of EHV1. During these EHM outbreak, to me, the important part is to focus on the older horses. And we've seen that with the, I have to think about 2021 multi-county outbreak we experienced here in California, where show horses, potentially exposed show horses, went back home and then spread EHV1 at home. The horses that ended up being euthanized were not the show horses. The horses that ended up being euthanized commonly were the old retired horses. There's increased susceptibility in older horses, and these are the horses that during an outbreak, we truly need to focus on. If there is 2 aspects that I can point out towards the management of horses at that place. The first one is proper separation of visiting horses or non-resident horses or new introduced horses from the resident population. That's generally common sense that apply to all pathogen. How long, it's debatable, 21 to 28 days. More importantly than the separation is the monitoring of non-resident horses. These are horses that are stressed in a different environment, want to be sure that they're not experiencing recrudescence of a latent infection as example. But we also want to monitor the resident population of horses on a daily basis. I know it's not done. I own 2 horses. I'm not taking the rectal temperature on a daily basis, but I look at these horses, and every so often when they're punky, I take the rectal temperature. My point being, if the resident population would have been monitored, I'm certain that some of these horses would have experienced fever prior to the first horse becoming recombinant. And then kudos to the veterinarians that single-handed this outbreak with the farm manager and all the people involved there. They were able to manage this outbreak in the field, many hours, many drugs given, but the outcome, in my opinion, was exemplary and positive considering the circumstances that involved this outbreak. And that's all I have for you, and glad to entertain any questions if there are any.
Thanks, Nicola. Does anybody have any questions for Dr. Pasterla? Dr. Pasterla, I have one question. What was the viral load in the nasal swab versus the blood on the neurologic and non-neurologic horses?
The nasal secretion. So so the question is, are there any differences in peak nasal load, viral load between EHM and EHV1 horses? And there aren't. And this is something we have seen in comparing, larger number of affected horses with respiratory signs and fever and horses with EHM. The difference is not at the level of the nasal secretion. The difference is at the level of the blood level. So the level of viremia is what differentiate an EHV1 only versus an EHM case. And that also depends on when you collect the biological sample, well understood.
The question I see right now. So thank you. If you have any additional questions, please feel free to reach out. Dr. Pasterla has listed his email address on the slide, and we have his information. If you'd like to send me questions, I can forward it on to him. Thanks, Dr. Pasterla. At this time, we're going to go into a topic that is causing a lot of questions, but I'm not sure there's many answers. But to bring us the answers and give us an overview on the tariffs and horses is the American Horse Council, Julie Broadway and Emily Stearns.
Thank you, Dr. Flynn. We appreciate being invited to speak with you. I wish I had more definitive answers, but we're going to do our best to tell you what we know at this point in time. Bear in mind, things are changing, as you guys know if you're watching the national news, changing almost hourly, but we'll do our best. So tariffs may impact horse movement. Potentially tariffs could impact horses, that are crossing international borders for competition, for breeding or relocation. Requirements differ for temporary versus permanent import or export. We are also looking at tariff codes and rules of origin and temporary impacts and exemptions. There are also a number of products that our industry uses that could be impacted by tariffs. We have been in touch with the Equestrian Canada, the Canadian Thoroughbred Horse Association, and others, the Customs and Border Patrol, and trying to nail down some details about this. And so I'm going to turn it over to Emily, and she's going to share her screen to tell you what we have learned at this stage and how we think it's going to impact our industry. So, Emily.
Hold on. Can everybody see this?
Yep.
Great. So just for all the information I'm going to cover today, don't feel like you have to memorize it. We've put the majority of it into a resource site on our website. So if you go to horsecouncil.org and just drop down from the resources, tariffs is right there. We are, apologies. We are updating this as information comes through. Like Julie said, information is changing rapidly. The only consistent thing is the inconsistency for the most part. Just an example, there was another announcement on the China tariff being raised about 45 minutes ago. So we're doing our best to share information that's evergreen. And if you're looking for country-specific rates, we can help you find that, but we're doing our best not to share those directly, just because nothing is set in stone right now in terms of specific rates. So like Julie mentioned, we have two major considerations. We have horses coming in for temporary import and horses coming in for permanent import. What we've done is we've put together this handy infographic. It's 6 pages and it breaks it down, especially in terms of the temporary imports and what your options are. But what we really want people to know is that if you are bringing a horse in temporarily, that the requirements for tariffs and the time period for what's considered temporary versus permanent for tariffs, which is determines the duty paid when the horse comes in, is completely separate and different from that for health requirements. So Canada is a really great example because Canada, it's 30, 60 days, something like that, of a horse coming in as a temporary import. The horse is then considered a permanent import if they stay past that point for health requirements. However, for tariffs, the temporary import bonds that are available for horses and the ATA carnets, which are basically like a tariff passport for travel, are both good for up to a year. So that is where that kind of differs. And so we see people kind of panicking in terms of timelines for tariffs. But the big conversation point for that is a lot of them are mixing up the requirements for health permitting versus customs permitting. For temporary imports, there's the temporary import bonds, and that is when you essentially pay the tariff up front and you receive it back when the horse leaves the country before the year end is out. And then the ATA Carnet, which is, again, you apply for that through one of 2 vendors, and it's basically a free pass to go back and forth across the border as often as you want. And these items are both true for whether you're coming from Canada and Mexico, across land borders, or if you're flying in for competition. Most recently, the announcements, and we did put an update on the most recent announcements here just from the 9th. Most recently, the announcements of the all country tariffs on again, off again came up, and they've been delayed 90 days with the exception of China. And for Canada and Mexico, as of right now, horses are still considered exempt from tariffs for horses coming in from Canada and Mexico, because the exemptions are for any items that fall under the USMCA free trade agreement still. Even if they're not considering it a free trade agreement anymore, they're still exempting all the previous items considered under there. And however, again, if that changes, it'll change rapidly. Horses, when they come in on tariffs, are considered under various categories. The major ones are stallions coming in for breeding, mares coming in for breeding, and essentially all other horses coming in for non-slaughter purposes. Other items that are also being considered under tariffs are semen, frozen semen, and embryos. Any other horse item, carriages, art made with horsehair, things like that. All items considered for husbandry. So if you're getting imported hay, grain, other feedstuffs, supplements, things of that nature. Currently, there are exemptions from the latest executive order for medical supplies, specifically antibiotics, antiseptics, and anesthesia. We're keeping an eye on that because in terms of the veterinary community, those are probably going to be the ones that hit you the most. Vaccines are also still considered exempt under there because there has been some discussion in the administration that they are going to remove those exemptions. Again, nothing is set in stone. They could decide to remove the exemptions on Monday and reinstate them on Tuesday. It all kind of just depends on how things are going at the moment. But as of right now, if the tariffs are back on in 90 days, we believe, unless we hear otherwise, all horses, with the exception of those coming from Mexico or Canada, would be under tariffs coming in for permanent residency. That would also include all of the feedstuffs, husbandry stuffs, tack, things like that. Right now, if you have a horse coming in from China, which racing would include Hong Kong, they theoretically might have 145% tariff on the value of the horse. Currently, at this time, we have spent several hours on hold with Customs and Border Patrol, have several unanswered emails from Customs and Border Patrol that we're trying to get clarification on what this means. And in terms of the various categories of horses, who's actually going to fall under the being qualified and who's not. But for the most part, for the evergreen information, we really recommend, we've written it all down, contacting a licensed import broker. They have access to tariff databases that the general public do not. We have tried to sign up for them. Registration is currently broken, all kind of par for the course in the chaos at the moment. But the licensed import brokers, they are the professionals. They have their most up-to-date information. And so this is different from your typical horse transporter because horses have typically not had to worry about tariffs. But a licensed import broker will have all of the current customs and tariff information. And then the rest of the article talks about the difference between temporary and permanent movement, provides some more resources. The harmonized tariff schedule is the kind of international code of how we categorize horses and all other items that are able to be tariffed. Horses, we list this in this article, but horses fall under Chapter 1, so it's all right there under Chapter 1. And then for horses coming in from countries with a free trade agreement, there's a free trade agreement tool, so you can kind of see what's going on there. And again, the differences between temporary and permanent imports. But again, the biggest thing that we've been telling people at the Horse Council is you need to know if you're importing for temporary or permanent purposes. You need to know what country your horse's origin is. And origin typically falls under where the horse was born, not where the owner lives. So you need to have documentation for the origin of your horse. And that can be a FEI passport, that can be any kind of other registration papers or something like that. But again, you need to understand the rules of origin for the country you're arriving to. And then lastly, check in with the licensed import brokers because the information is changing so fast. At this point, we made an update yesterday or on the 9th at 11 a.m. and then had to update again at 2 p.m. So again, this is pretty par for the course in terms of keeping things kind of up to date and accurate. So check in with those licensed import brokers because they will have hopefully the most accurate information.
And I'll just add, we are addressing personal individual circumstances as best we can. We are getting emails from people asking us about their particular situation, and we're trying our best to help them. But again, as Emily said, we are desperately trying to find information from all the sources that we can, and we don't want to take our word for it. We want to refer them to others that we think are subject matter experts on this and trying to tell them where to go to find what they need. And right now, it's just a very complex, convoluted kind of situation that we're all trying to navigate.
And we're not alone in feeling that. We just got back from the National Institute of Animal Agriculture conference yesterday, and all the other animal species are also in a similar boat. So there's camaraderie in the situation out there right now, but that doesn't necessarily provide anybody with any comfort.
And I'll just add, it's not, for our industry, it's not just about, as Emily said earlier, it's not just about the horse transport. It's about hay, grain, lumber, aluminum, steel, other things that are used in our industry that we're still trying to navigate and sort of figure out. We've been in touch with a number of other organizations trying to kind of mutually find our way, and I think we're all still puzzling this out.
Mm-hmm.
So Katie, we'd be happy to take any questions that the group might have as best we can.
I'm looking in the chat. I don't see any yet. If folks have questions, please feel free to put it in the chat or raise your hand. Emily, can you just go over real quick again on your how to navigate to this page from your website?
Yep. So if you go to horsecouncil.org, just our main homepage, you'll see resources right here. Tariffs are right at the top. And it will bring you exactly to this page I just showed you. So we have the live updates at the top. We have this little graphic that just kind of hits the high points. We have our 6-page infographic that you can download the whole PDF version of. And then we have all of our live updates as well as our larger, more detailed article here at the bottom.
And Katie, I'll just add, we are well aware that we are reaching that point in the year where we have competitors who have been in Florida, who are going back to Canada, and individuals who are in Canada who are sending breeding horses into the US. And we're just trying our best to advise and navigate them through all those challenges.
Okay. I'm sure there's more to come on this, and we appreciate your efforts at the American Horse Council to try to get us some answers and information and putting that information on your resource page. So thank you very much. I don't see any other questions, so I want to say thank you to all our speakers today. This presentation shall be uploaded to the Equine Disease Communication Center next week. And as always, I appreciate any thoughts or considerations on future topics or speaker suggestions. For now, I'll say thank you and have a great day, everyone.